Hi guys. I've been asked to by one of my followers to do a video on my experiences of symptoms when I had really bad health anxiety. Please note, I am not a doctor. I am just a person who has suffered from health anxiety disorder for about 10 years. And fortunately, I consider myself to be recovered, so I'm trying to impart some information to you guys that might be able to help you recover in the same way that I did. Okay, so some of you may consider my feelings on the subject of symptoms and health anxiety to be somewhat controversial, but I should go ahead anyway, despite the fact that I'm quite sure that this might upset quite a few people. Okay, so the information that I'm about to say, I apologise if you take offence, but health anxiety has no physical symptoms. I know it sounds like that cannot be true, because I'm sure there are many people at the moment watching these videos and health anxiety sufferers, and they're thinking to themselves, but I'm riddled with symptoms. How can that be true? That's not true. And the reason that I say this is because, as I say in all of my videos, health anxiety disorder is a psychological disorder. It is not a disease and therefore has no physical symptoms. If you do experience any symptoms from health anxiety, it's most likely going to be the anxiety part of the health anxiety. And anxiety does have physical symptoms. I think that's, I don't know much about biology. I did study it briefly for my own enjoyment. But I think the reason that anxiety has symptoms is because it triggers, I believe it's called your parasympathetic system. I might be wrong on that, so please do correct me if that's the case. But essentially it triggers your fight or flight response, your survival mechanism. So that has physical symptoms, for example, things like adrenaline, you know, fast heartbeat, anything really in preparation for running for safety. Going back to our, early days of survival. So obviously, breathing quickly, hyperventilating, panic, all that kind of thing, anything to do with fight or flight response. Obviously, anxiety is going to cause those symptoms to come up. However, health anxiety in itself has no symptoms at all other than anxiety, physical symptoms, that is. So health anxiety, like I say, is a psychological disorder, and it's defined by an unfounded preoccupation, I would say, about your health. So basically, it's based on the premise that you are worrying about things that there is no evidence of, no medical evidence of. So by definition, when you have health anxiety, it doesn't come with physical symptoms, because it's the lack of the physical symptoms and the physical medical diagnosis of illness that is actually what characterizes health anxiety, worrying despite the fact there is no evidence. So I'm sorry, but I would say that what you call symptoms is what, when you've understood health anxiety, we would probably refer to more as misinterpretation of normal bodily function. And I think part of the problem is the fact that when you have health anxiety, you can label anything. You can label anything as a symptom, and you can say, well, if I feel it, therefore it must be a symptom. It doesn't feel normal. But, from my own experience dealing with health anxiety sufferers, I mean, you can, there's a communication problem that goes on with your mind and your body, which misinterprets information and tells you something which isn't true. Health anxiety is a somatoform disorder, which is basically a communication problem between your mind and your body, and misinterprets information. So you might very well say, well, I do have symptoms, but you could have a person with health anxiety who goes along to the doctor and says, I'm suffering from this really bad symptom. And he says, well, what is the problem? And they say, well, every time I breathe, I can see my chest moving in and out, and I don't know what's causing it. And it's like, well, that's not a symptom. That's not a symptom. That is normal body function. It's a misinterpretation of body function. That doesn't make it a symptom. Okay, so I've established that health anxiety has no physical symptoms. It doesn't make you have palpitations. It doesn't make you have sleep problems. It doesn't do anything to you. It doesn't affect your body in a physical way. Anxiety does. The anxiety part of health anxiety will affect your body. It will cause those things to happen. But health anxiety in particular, it will not cause those things to happen, because health anxiety is not a disease. It is a psychological disorder. However, that doesn't mean that health anxiety has no symptoms. Health anxiety does have symptoms, but they are not physical ones. Health anxiety has behavioural symptoms, and it has psychological symptoms. So psychologically, the symptoms of health anxiety are, and this might help you if you're in a stage where you don't fully understand the concept of what health anxiety disorder is, and you're still caught in this loop of looking at symptoms all the time. Things like rashes and heart rate, and all these kind of things that you're worried about. The psychological symptoms of health anxiety are the belief that you're dying, the belief that you're not safe unless you check yourself all the time for signs of illness. Let me think. Psychological signs of health anxiety. Needing reassurance constantly to somebody tell you that you're okay, needing to seek doctor's advice because you don't trust yourself anymore, and those things that are psychological are a result of the psychological disorder that is health anxiety, or hypochondriasis. So it also has behavioural symptoms. And the symptoms of health anxiety in a behavioural sense is things like body checking, when you actually change the way that you live your life because of your fears about your health. So changing the way that you eat, changing the places that you consider to be safe, like, you won't sleep in your bedroom anymore because it doesn't feel safe. You change your behaviour to make you feel safe. And not being able to shower without somebody being in the bathroom with you in case something happens to you whilst you're in there. Not being able to sleep in your home on your own because, something might happen, there'd be nobody there to rescue you. And not wanting to take medications in case it triggers something bad, and then, you're going to end up with a bigger problem. So there are a lot of symptoms from health anxiety, but they're not physical symptoms. They're psychological and they're behavioural. So going back to the talking about physical symptoms and relating this to the person that asked the question about my experiences with symptoms when my health anxiety was really bad. This is a question that I get asked quite often by people on Facebook groups and, support groups and everything. And really speaking, if you're asking questions about symptoms in terms of health anxiety, the main thing that does is it indicates what stage you're at with your own health anxiety. And generally it raises a red flag saying that you are either still in the stages of denial that it's psychological, or you are seeking covert reassurance through somebody like me that will enable you to continue this path of seeking medical reassurance that you are not ill, because you still don't want to address the fact that it's a psychological problem, and these symptoms are nothing other than misinterpretations of something that a normal person without health anxiety disorder would not even consider to be symptoms. So I know that's quite a difficult thing for some of you to understand, that that if you still want to know about symptoms, then you're still in denial about your health anxiety. And I need you to understand that the whole point of me doing these videos is to hopefully try and help people recover in the same way that I've recovered myself. If I was to talk now just about symptoms, the things that I experienced, you know, the specifics of the exact sensations and symptoms that I had, or, you know, not that I consider them symptoms anymore, but if I was just to talk about those, then firstly, these videos would become a trigger for people. They would watch them and think, oh my God, I've had that. Does that mean something's wrong with me? Or it could trigger something where somebody thinks, oh, brilliant, she had that as well, and there was nothing wrong with it. So that gives me a reassurance that I don't need to worry about that problem either. The problem in doing that and allowing you to gain information from me about physical sensations and symptoms is the fact that it's perpetuating this belief in you guys that it's still a medical illness that you are suffering from and not a psychological one. So I'm very sorry, but I'm not going to indulge you guys in a load of information about things I experienced, because they were misinterpretations. I can see that now, and even things that you might term to be symptoms now that I experience, you know, a sensation that I might have which is reoccurring, I still attribute that to psychologically suffering from health anxiety disorder, and I don't react to it as if it's a symptom. So it's not going to help you, and it's not going to help me if I start perpetuating a belief that everything that you are experiencing is to do with medical illness and not to do with psychology. What I'll do somewhere when I can pluck up the courage is I will show some of my video recordings from 10 years ago that I recorded when I was experiencing health anxiety and talking about the things I was going through at the time, just to put into context where I came from, because it's all very well me talking about how bad it was, but I think sometimes you guys being able to see it in all its glory might be able to help you that understand my path of recovery and give you hope that I may not just be making up everything that I'm talking about and speaking rubbish. So sorry I didn't really sort of help you all that much in terms of talking about symptoms, but unfortunately or fortunately, health anxiety doesn't have symptoms. You have a psychological or emotional disorder that causes you to misinterpret what is actually normal. So you know, try and not focus on symptoms and try and focus on the disorder itself, and you might very well make a lot of progress. Okay, so until next time, thank you and goodbye.